Good evening, everybody, and I welcome you all to this DNB Clinical Meeting Series. And it gives me a great pleasure to introduce today's speaker, a distinguished expert at the intersection of technology and medicine. Dr.Subramanyam.Mahankali has stepped into the role of being a regional director for anesthesia services at Krishna Institute of Medical Sciences, KIMS, Bengaluru, gearing up to open soon and leading the journey in building a center of excellence in precision anesthesia. His achievements and his accolades are numerous, from contributing to journals and textbooks to formulating guidelines. He is also the president of the Aorta Society. Not only a skilled clinician and a forward thinking academic, but also a deeply grounded and approachable soul, known for being a patient mentor and inspiring teacher. He has a rare gift of making complex ideas simple and very engaging. Despite of his numerous accomplishments, what stand out the most is his warmth, his passion for teaching, and his unwavering commitment to sharing knowledge. A true role model for lifelong learning and compassionate leadership. Please join me in welcoming Dr. Subramanyam.Mahankali, a trailblazer in the field of anesthesia with deep passion for harnessing the power of artificial intelligence to enhance perioperative care. With a strong foundation in clinical anesthesia and a forward looking vision for innovation, he has been in the forefront of exploring how AI can transform patient safety, decision support, and precision anesthesia delivery. So, today in his talk, he was going to take us through how machine learning, predictive analytics, and automation are reshaping the way we monitor, plan, and deliver anesthesia to our patient. It's a privilege to have you on this platform, and it's all yours.
Thank you, Dr. Kalpana. Very kind words. I'm very honored to be on your platform. Am I visible and screen visible?
Absolutely.
Fantastic. Thank you. Now, I'm even more thrilled today because the future or the next generation is with us. And I certainly feel every one of you here and those who were not part also, our young, they will take this forward, and this adoption of an AI, or we can call it as AI-enabled anesthesia, will be something in the future. If we, young generation, take it forward, it will be a huge achievement, right? Okay. Now, how many of you recognize this logo? I'm pretty sure almost every one of you recognize this logo, and this is of Google Maps. How many of you think it is AI enabled? Now, if I ask you to show your hands up, I'm sure everyone will show your hands up. Or sometimes you're worried, is it AI or not? Okay, just look at it. For example, let's say you land in Bangalore, you come to Kempegowda Airport, and I invite you to my hospital, which is at not very far, but still quite far. Now, the moment you type the address where you want to go, before even that it has your phone would have recognized by GPS where you are and where that location is, and it gives you a route map. It's times have changed, isn't it? A few years back, maybe when I was doing PG, if I had to go from here to Delhi, from Delhi to AIIMS, it was a lot of planning had to be done. Here you land there and you know how to go. And on your way, there are plenty of things which are happening. For example, traffic, is it heavy or not? That is fed into the information. So if you carefully look at it, even the Google map, which we use today, every day, most of us, when we're traveling, so we find that Google map has a very AI enabled features in it. So to help you for navigation, it helps us predict real-time traffic. We can avoid the congestion. We can reroute in case if it is very busy, and expected time of arrivals. It's so important, isn't it? We can tell them we'll be there in such a time, and it gets adjusted according to traffic. And in case if there is road works going on or accident, etc., it will let us know. And all these features are there, these AI enabled features, which helps us safely navigate and predictably arrive at the destination. Such a sort of thing is definitely happening in the AI, in the healthcare. I'm sure every one of you recognize this gentleman. And just briefly read his statement, which he was quoted a few months back. Now, AI is probably the most important thing humanity has ever worked on. This is coming from one of the top technocrats in the world, right? So, and I and he says, I think of it as something more profound than electricity or fire. Now, this is really important there. So, he thinks it is more profound than electricity or fire. Now, there are some general purpose, advances which happen, which impact so much of our life. And I also feel this AI and using AI tremendously enhances what we are doing, how we deliver our care, etc. But not just the AI. If you don't look just from the AI platform, okay. Now, what has happened over the last decade or two is, the data sources on which is available for us has tremendously multiplied. Now we are already on the cusp of plenty of digital consultations happening, whether it is government sector or in the private sector. There is plenty of smart wearables. It could be a smart ring or a smart watch, or plenty of smart wearables which we will see. And also something known as digital therapeutics has arrived, which was not there at all, right? And clubbed with it, we have got medical Internet of Things, cloud computing. On top of it, you add artificial intelligence. It's tremendously going to change the way we deliver our care. Now, I know these are all buzzwords which you keep hearing. Sometimes it takes you away from the point what we want to enlighten, but let us see. Now, what is AI? That is something which you probably will be thinking about. What should we call an AI? AI is something, is the ability of a computer or a computer controlled robot to perform tasks associated with intelligent things, intelligent beings. In this case, it is humans, right? So the computer or a computer controlled robot can perform tasks which we normally associate only with the human beings. What are those? It should include, it should be able to learn from the data, right? So when we were children, when we had to walk, we learned from the data, which one we should avoid, which one we should walk through, etc. Right? Reasoning, why we cannot go certain things. That reasoning has to be there in this also. And it should be able to self-correct, and it should be able to perceive. In this case, vision and sound, etc., are already being incorporated. So in short, a lot of platforms are being developed wherein which AI is being incorporated, and healthcare is one of the biggest domains. Now, just to give an idea what is happening around the world, now FDA is one of those, you can say, even though it's a US regulatory body, a lot of countries follow what FDI allows, and there are 882 FDA authorized AI enabled medical devices. Now, it is FDA authorized AI enabled medical devices. And look at that, which specialty is more? Obviously, certain things are more, but in anesthesia also we are starting to see. Now, but if you look at 2025, the latest data which FDA has published, nearly 1016 medical devices are there, right? Every day it's advancing. Maybe next time when we talk, one of you might have have probably would have invested or probably made up a AI-enabled anesthesia device. Now, also look at the size of the market. The AI in healthcare market is projected to reach 195 billion by 2030 in 5 years. 195 billion is something exorbitant. That is the amount of a market which is there for AI in healthcare, right? Let's say even if we take anesthesia as 5% of it, that will be 10 billion worth of market share is there for the people who want to work in this domain. Now, if we closely look at it, what are all the different roles or where it can help us in healthcare or in the anesthesia or in the perioperative care? Now, this AI can help us in early detection of ailments. I will go through some scenarios. It can improve our decision making on the data, help in the treatment, so expand the services which provide. So to give for people who care for these people, giving a superior experience to the patient. All these are part of the AI. We'll see, go one by one and see where we can incorporate. And also, if you look at here, so nearly 116 startups are there which are trying to work on healthcare related AI. They even have, I certainly want to establish what is known as a CHAI, Consortium for Health AI. There are so many companies are working, and they are all working round the clock. Within a matter of few months, you will have tremendous amount of applications which can mine the data and help us improving the care. Now, let us see some applications to help us understand, go into detail, right? Now, I don't know how many of you are already using this. This Google Translate is one of the boons for me, especially if international patients come in, either from Middle East or Africa or anywhere. You need not have to wait for this person. So it is an AI enabled application, right? In the olden days, we had to wait for the translator to come in, and he used to take his own time, and it was not complete also. So as a result, this has been a very, very, of major improvement in our everyday care. You can communicate, you can have a conversation, not just once, you can have a complete conversation. If you're not started using, please start using it. Now, this was, Google is an international company which works only with the international languages. What about people coming from Manipur, Nagaland, or people who can only speak particular part of Indian languages? I don't know how many of you have heard or know about this. There is an app called as Bhashini. This is by the government of India, wherein which all 23 Indian languages can be, you can converse in any of them. It will automatically change it, and it will listen to our the way of speaking. So it is tremendously useful. If you are already not started, try it out. Okay, Bhashini. It is called Bhashini. Now, the other biggest thing which is also happening is what is known as ambient intelligence as medical AI. Now, I'm sure many of you are working in setups wherein which already some amount of digitization has happened. Now, with digitization, what has happened is instead of looking at the patient and talking to them, lot of the time we are focused on the computer because we want to enter the patient's history properly. We don't want to miss anything, right? So as a result, the interaction between the patient and us, the quality of interaction has come down. But with ambient intelligence, you might have just a device like an Alexa device or a phone, which just sits in front of you, or probably it can integrate with the computer as well. As you talk to one another, just like how we are talking now, you just keep talking, it records the speech and it converts the speech into text and text to medical notes conversion. I'm not talking of sci-fi here. This is already being worked by a number of companies, including me. I'm trying to work in a different way, wherein which you just have a conversation with your patient. The device automatically records, and that recording is converted to text, and that text is converted to medical notes, depending on the buzzwords what we give. In case if you want to give any instructions to the patient, you can digitally transmit those instructions to their WhatsApp or other device so that they follow their post-operative instructions, especially useful for outpatients. It's a tremendously useful thing which is happening. This is also a part of a medical AI. Okay. Now, what also in this ambient clinical intelligence or ambient AI is there are a number of components which are already being worked out, right? For example, on the left, first on the top is far field speech recognition, right? Wherever you are in the room, if you're talking, it will recognize who is talking, and it will also, depending on the speaker, it will pick up, it is the patient, this is the doctor, and document it that way. And also, it has got a natural language processing, whichever language you're doing, whichever language are there. So it automatically listens to it and converts it into computer language. And it automatically keeps learning what are the words which are being used. So it gets very sensitive as we speak on, and it will also start to say whether it is comprehensive or not. So this forms an ambient clinical intelligence, an ambient AI in clinical management. Now, the other device which you probably would in the consumer segment, which you would have already seen, is this popular device. And many of you will already are wearing it. Now, I'm sure most of you know here, it not only shows you time, it's a smart device which can show you what is your rhythm, what is your fitness, how much have you walked. Carefully look at this device, no? all of you have seen how the Apple or other screens show. On the right side, if you see here, there is a round mark here. Now, if you have set a target of, let's say, 10,000 steps or 15,000 steps, no, there is a gamification of this is happening. It will show whether you have completed a circle or not. Now, we all, every individual likes to play games because we can see the completion. We can enjoy the completion. That concept gets imbibed in the mind. So that also is being used to give us a feedback whether we are achieving or not, right? So along with that, whatever fitness, it is also showing us a few other parameters, right? So this is there in the consumer segment, right? Now, if you look at their website, if you look at their presentations, these devices not only can detect those things, it can also detect what can cause a significant change in the physiological condition. Now, they have highlighted this. FDA also has recognized this. These devices can record ECG, can recognize arrhythmias. That's a big, big advantage, isn't it? It can not only now recognize with the AI, with the technology, it can even communicate to your relatives or loved ones or to your doctor also. So that is the kind of advance which is happening. One is a recording of the abnormal events, transmitting it, and waiting for the action as well. That is the kind of change which is happening in the consumer segment. Now, if you look at, actually, we feel sometimes in the medical field, we are very, very careful before adopting it. But is there any reason why we can adopt it? Yes. For example, look at this application. Now, I don't know how many of you used it. If an adult or if a patient is wearing it and walking, if they fall down, now these devices can recognize if there has been a fall. And this can communicate to your relatives as well as to the nearest medical center. Why can't we have similar things for the patients in the hospitals? Now, obviously, cost is always a concern, but it will get cheaper. These advanced technologies are like that. The more we start to use, it will get cheaper. So again, it's a wonderful intervention wherein which fall recognition can be easily done with the help of these devices. Now, I don't know how many of you already had their hands on such devices. For example, in the age when we were relatively in our training days, to get a blood glucose measurement, you had to take a sample and send it to the laboratory. Now, then came bedside devices. For example, you prick your finger and use the strip, and it can show you either the blood markers or the urine markers. Nowadays, you have continuous blood glucose monitoring. Now, it's a wonderful invention, whether it's for a diabetic or somebody who's caring for a diabetic. It gives you a continuous blood glucose monitoring. It will help you reflect what happens to blood sugar levels when you eat a certain food products, or when you have a drink, or when you're tensed. So early morning, what happens? It gives you a wonderful track record and also tells you you're in the normal range or not. The medication is having adequate effect or not. Nowadays, patients are becoming so aware, especially in places like Bangalore. They will come with their printout of these, and if somebody is not fluent in recognizing this or doesn't recommend this, they think twice before consulting those people, because keeping up with the technology, keeping up with advanced technologies is very important in our profession as well. They realize that. Now, what also is happening is, if you see here, there are a number of other such point of care monitoring devices happening. What we saw is already what is there, which is being used in the consumer segment and also by doctors heavily. But there are few other point of care devices which are coming into the practice. Some of them are skin based, some of them are biofluid based, right? For example, let us see a few examples before we actually delve into what are the different applications where we are using. Even the skin-based wearable devices, it can be two kinds. One you can wear on textile-based, and those which can stick to the skin are the epidermal-based, the healthcare wearable devices. Now, if you are wearing one of those devices, so it can detect your heart rate, it can detect your temperature, it can detect your muscle activity, along with keeping you warm. That's wonderful, isn't it? After a surgery, or let's say you have a neonate or a young child, you are worried whether the heart rate will go down or not. You have this, it can automatically measure you the respiratory rate, what's happening with the oxygenation, what's the heart rate. It will automatically communicate to the nearest device and to wherever you are. So the same thing is also happening with the skin-based device as well. people call it as electronic skin or tattoo-based wearable device, wherein which if you apply a tattoo, any part of it, these tattoos are very sensitive, and they stay for approximately 3 to 4 days. It can detect the ECG, EEG, and EMG. Now, this is about to enter the medical market, but this is the sort of miniaturization of devices, and not only catching up the ECG, but also transmitting is also happening. So all this, what it does is it gives you a wonderful advantage. They're also happening not only on the skin based, but also on the biofluid based as well. There are a number of devices which can help if they are the sweat based or the tear based devices. Okay, let's say for example, you see this fluid here. This small plaster like thing, if you apply it on the hand, right, or anywhere in the body, there are micro cuvettes there which collects the sweat and tells you what is the sodium level, what is the potassium level, what is the lactate levels. Now, earlier or even now, most of us do ABG to detect the lactate levels. These devices can give you not only just one shot continuously what is happening. So now all this miniaturization advances are happening along with collection of data. So what essentially is happening is our monitoring historical trends. If we look at, we used to put invasive blood pressure for every patient. Now we have got non-invasive devices which are extremely good. So we have moved from invasive to non-invasive. Nowadays, the trend is we will be moving to non-contact devices where you don't need to clip something, anything at all. You put a tattoo, it will help you monitor. Instead of on demand, we're moving towards automated ones. We had a continuous sometimes. Now we are also moving towards a domain where in which it's a predictive monitoring. When we move to this predictive monitoring, this is where the AI will start to play a role, right? So now it can not only for this, but also it can be used for regional organ perfusion as well, right? So why I told you this is because many of you may not be aware that this non-invasive device, if you just along with your bladder catheter, if you put it very close to the kidneys, it can detect what is happening with the oxygenation of the kidneys. It can detect whether the patient is likely to develop renal failure or not. In that way, you can detect much early so that the oxygenation of the kidneys, perfusion of the kidneys is protected and we can prevent the kidney failure. And many of you would already have one way or the other would have used ChatGPT. Now, it's not new. It's nearly 7 to 8 years old. It was launched somewhere in 2018. But since 2013, this ChatGPT, which has been trained on billions of web pages, and also can reach the online, whichever platform it is. So it's been a wonderful development what has happened. So, but there is a difference between AI and this. This is a generative AI, right? It has been trained with that model. Just look at number of people who are using it, visitors who are using it. In April 2024, 1.8 billion visitors were there, right? The population of the world, our population of the world is close to 7 or 8 billion. Nearly 1/5 of population are using this, right? We are not the only ones. 1/5 of the population is being used. Only few underdeveloped countries are not using it. But now, imagine this, when we are access to so much of technology, so much of information available all over the net, it really can change the way we are doing, right? So now there are various ways when we collect data, how the machines, the artificial intelligence can be used. And this we call it as knowledge representation, right? So to interpret, to work around, various forms of representations are used. I don't want to go into details, but I will give you some examples just to help you understand why it works, right? For example, rules-based, maps-based, flowcharts-based, all these are the way the algorithms work. Let us look at the simplest example, right? So we have a non-expert user who asks a query, who has a question. So with an interface. Now, into that from there, it goes to the inference engine. And instead of humans answering it, they will have a knowledge base. This knowledge base is slowly accumulated or trained by an expert in that field. And he has fed into this knowledge base. Every time the question is asked, this device will go to this inference engine, go to the knowledge base, and goes back. And if it's needed, this gets augmented. And that is how the AI loop is working in practice. Now, let us see a few practical examples where the medical AI is being used. The first thing is the rule-based AI, right? Now, it follows a rule if we are given a scoring system. So, we've all heard about early warning systems, right? So, we've labeled it as clinical early warning systems. I don't know how many of you know, around 25 years back, we didn't have this early warning scores. So, one hospital in London, Royal Marsden, they were the first ones to start using this early warning systems. So now early warning systems, it was in the paper format. Now the moment you digitize it, there are a number of advantages. So you can easily detect and take appropriate action as well. For example, in these early warning systems, these are the common parameters which are used. For example, respiratory rate, oxygen saturation, all these normal parameters which we look for post-operative care. The moment you score these patterns, you score them, the machine reads it, it can understand the severity of it and communicate with that appropriate person. For example, instead of a nurse calling, system can automatically inform the appropriate nurse or the doctor or the consultant who is supposed to be responsible for these patients. So, how is it based on? Just based on very easy for it to calculate the total score. Okay, this is one easiest or practically useful way where medical AI is already being used. The other big thing what is happening also is in the use of antibiotics. So people even have developed a medical AI chatbot called as the new Alexander Fleming, right? So now instead of waiting for 48 hours for the culture or more than that for culture, so the moment you see a gram positive on the microscope and its coccus and chains, it can almost tell you what kind of bacteria it is and helps you choose the appropriate antibiotic for that person, for that particular slide what you're getting. But what it can also do is it can collect information from other sources as well. We'll come to that in a minute or two. Now, for example, if let's say you take a blood sample, normally for an arterial blood gas sample, you take it. So now, if you develop, already our apps are there, wherein which these values can be easily put into the chart-based system. The moment you take the sample, the machine automatically puts it into various places depending on pH, depending on arterial plasma bicarbonates and CO2 levels, and tell you whether you are metabolic acidosis, respiratory acidosis, alkalosis, or chronic respiratory acidosis. Automatically it puts you and gives you a clue. No, this patient, the sample what you have taken, is having a acute respiratory acidosis. What it can also do is it can do this chart-based AI also and tell you whether it is compensated or uncompensated also. It's a powerful clinical support, decision support system, isn't it? So it just follows these rules and can let you know that this is a uncompensated respiratory acidosis. That is the way it is. The AI is moving now. Now, I'm sure many of you suddenly face a patient with a pacemaker on. It's a fantastic example where AI is very helpful. Now, there are more than around 250 or 300 companies which manufacture pacemakers. Now, I'm sure we all want to know what kind of pacemaker it is, whether it has a defibrillation as well. That decision was, if the patient was not carrying any leaflet about it or a bracelet about it, we never had a clue. Especially if patient cannot talk the appropriate language or is unconscious, makes it even difficult. Now, with the powerful AIs now, you take a X-ray and feed that X-ray into these AI apps. It can tell you exactly who is the manufacturer of this device. It can read the code there and tell you this has a defibrillation or not. So that is a tremendously useful AI app. So wherein which it is helping you enhance your clinical service. Now, just before coming here, I just thought I will go through and ask ChatGPT what are all the different applications in anesthesia. Now, it automatically comes out, it says, yes, it can be used for preoperative risk prediction. It can be used for intraoperative monitoring, automated drug delivery. Let's see a few examples how we are already using it. Okay. Now, but if you carefully look at it, I personally feel there are 4 different aspects wherein which the AI can enhance our practice. The first thing on the left top side is the closed loop anesthesia delivery systems. Now we are on the cusp of it, wherein which we can start to use closed loop anesthesia delivery safely. Am I using it now? As of now, no, but it is possible. I'll tell you why. Now, other biggest thing is clinical decision support systems. It can help you enhance your clinical decision. It supports your clinical decisions. For example, we will come to that what exactly it is. It can also be used in teleanesthesia to augment the reality and also as a mechanical robots. So these are the 4 main domains I feel where AI is being used or can enhance our clinical practice. Now, I was talking about wearables. Now, look at this, the kind of wearables which are available in the consumer market. So we all have used probably a smartwatch. We probably have heard about smart ring if you're given it to your fiance or something. But look at this here. So it also a component as a smart shirts. Now, smart shirts not only make you look smart, but can also determine what muscles activity is happening. It can measure your temperature. For example, if Boomerang is getting tired and particular part of the body, it can detect the EMG in that particular part and say, no, your back is the one which is straining. Your front of the body is getting strained. So it can also have a GPS tracker. Now, Bluetooth key trackers are there for those people who are missing this. And there are smart shoes which helps you. Now, one is to correct the posture, and smart shoes are also being used by professional runners also to understand what is their weight distribution, etc. Imagine there's a smart socks. It's a wonderful device. We have always, especially when I do young infants or neonates, I was always in my mind, they will go into apneic spells. If they go into apneic spells, what to do? Can we detect hypoxemia? Now, those pulse oximeters never used to work. But imagine these smart socks or smart gloves. If you can put it on the child or the infant and leave it there, it can measure oxygen saturation and temperature continuously and transmit it to wherever you are. That's absolutely wonderful thing, isn't it? So also our pipeline are smart pants, smart belts, smart rings, and smart bracelets, and also smart glasses. No, you click a picture there, it will tell you what is what is the device or etc. Right? So tremendous amount of things are happening with the wearable devices. Now, these are happening in the consumer segment. Now, we have to be open enough to see how useful they are in our practice. Does it validate? Does it correlate with our clinical measurements? And that is where we can take it next. By themselves, if we leave it for these consumer segments, we will not know whether it's useful or not. So we can have an opportunity wherein which we can, along with the routine care, we can see whether it is useful or not. If so, how much useful it is. The next biggest thing which is going to happen is development of what is known as a human digital twin. Believe me, probably in the next few years, all of us will have a one human digital twin. Now, a terminology of, let's say, for example, simulation we have heard about, but this digital twin we have not heard much because it has not been discussed yet. It's not a new concept. This digitalization, digital twins, so has been there for nearly 35, 40 years in this space science, right? So this NASA or even ISRO, they construct the digital twins of the of the space mission of the aeronauts who are going there and study them before they can send them up into the air. Which part of the device, which part of the space mission can be compensated, what will happen. All these are being studied in detail. And if you have seen Apollo 13, you will probably know what it is, right? So the digital twins are there, already been there. Now what we're having is we have got enough sources to create a human digital twin, right? Instead of just values about heart rate, blood pressure, and only these useful small parameters there, we can create a human digital twin from various sensors which are already being there. I talked about so many sensors there from top to bottom. All these sensors, if they are feeding the information, it is very easy to create a human digital twin. The moment you create a human digital twin, which we know the capacity of the heart, we know the heart rate, blood pressure, how liver is functioning, how heart is functioning, how lungs are there, what is with the kidneys. Very easy to create a model. It's a personalized model which can help us detail. If you feed on top the laboratory work and imaging, it can be a tremendous source for us. So it can help us pick up the red flags. No, this patient has this, they cannot tolerate this. Now we all know 2 meds or 4 meds, patient can tolerate a surgery. So the similar kind of thing about individual organ function, you can, instead of just simulation, you can use this human digital twin to closely understand and estimate what is happening. This is going to get better and better. You will have this in the near future. The other common application which I see, which is on the cusp, we will almost about to start using, is closed loop anesthesia delivery system. Now, we all know the components of anesthesia are three. One is to keep them asleep. Other one is to give them adequate pain relief. Other one is give them adequate muscle relaxation, right? Now, with the availability of target controlled infusion and us using this BIS monitor electrical activity in the brain, it gives us a tremendous advantage. For example, look at here. All three components of anesthesia are to make sure the patient is safe is being given through IV route. And all of this can be measured what is their effect. For example, this hypnosis provided by the propofol can be easily monitored with the BIS. We want to target between 40 and 60, and we can understand, oh, at what stage the patient is becoming light. Within the closed loop, it can automatically increase or decrease according to situation what is happening. We also having devices which can help us monitor nociception, how much the patient is feeling pain. And we have drugs which work quickly and go off quickly. For example, remifentanil, which can be used again in the closed loop delivery system. Again, neuromuscular relaxation, very easy to monitor relaxation and top it up automatically or ask our suggestion with our approval, all this can be done. In this way, the anesthesia or the care what we are providing will become much more standardized, much more safer, and easy to predict and understand what is happening. Now, slowly and surely, what is also is happening is adoption of clinical decision support systems. Now, for example, I give you some example. The AI and echocardiography for cardiac sonographer. Just have a look here. There are a number of AI applications, number of devices which can record the echocardiogram, right? These echocardiogram apps or the machines are being enabled with AI. For example, if moment you put your probe on the heart, it can, you record it, it can easily track, can tell you which part is LV, which one is ARV, as long as it store those standard views. It can map out what is the diameter in the systole, what is the diameter in the diastole, and it can detect wall motion abnormalities and can real time tell you what is happening with the LV function. Now, if you thought those devices have limited capability, so there are people coming up with newer ideas. For example, there's this company called US2 bar AI from Singapore. The standard views for 5 or 6 views what we have, those heart you can record just 6 to 8 seconds or 10 seconds picture and load it into the system. Within a matter of seconds, less than a minute, it will give you a full echo report. Even a normal cardiologist will not be able to give such a good echo report. So what is the cost of it? The cost, as I said, as we more and more we use, it will come down. It just costs probably close to around 250 rupees or 2 Singapore dollars. So if you recorded those images preoperatively, you're worried whether the patient is able to tolerate, how is his heart function, you can easily get it, record it, and send it there. Instead of just eyeballing, you will have a full comprehensive report. And this has been trained on thousands of images. Now, what also is possible is all these devices can help us detect the IVC. What is the IVC compressibility? If you put it on the lungs, it can tell you, detect B lines and say whether there is fluid overload or not. All these are clinical decision support system, CDSS. So it's very, very common to have. I don't know how many of you already had your hands on this machine, the Hemosphere. Now this device, it said to predict hypotension before it happens. Apparently, these devices can predict hypotension at least around 7 to 10 minutes before it happens. Now, that's amazing, isn't it? What it is doing, it's a non-invasive device put on the hand, continuously capturing the pulse waveform, understand what is happening with different parts of the circulatory system, and able to predict. That's a wonderful achievement. We are able to, lot of times, let's say, for example, if you're using TCI, you predict, oh, surgeon has come, he will put an incision, so the BP is going to go up, so you'll increase the depth of anesthesia. Here, if you're able to predict hypotension is going to happen, so we can be much more ready. Do we want to treat it at that time? May not be, but at least we have the ability to predict what is going to happen depending on how the body is reacting. Now, the predicting may not be equal to treating, but at least we know it is going to happen. We can get ready with appropriate devices. What also is available is nowadays is the AI-enabled ultrasound probes for regional anesthesia. The moment you put probe at the specific sites, it can help you detect which is a blood vessel, which is a nerve, where to avoid, etc. It's a tremendous advantage, especially if you're a novice. What also is happening is there are AI-enabled robots which can perform intubation. Do we want it? We may not need to, but there are devices, there are AI-enabled devices to help you do slowly and systematically intubation, and these devices are real, it is there. There are also AI-enabled devices, robots which can do blocks as well. For example, in this case, this is doing a block, a popliteal block, AI-enabled robotic block for a popliteal nerve. It's quite good, isn't it? You can see all around the popliteal nerve, the local anesthetic has been deposited by here. So now, do we all want this? Have we reached the level of dexterity what is required? I'm not still convinced, because claiming on a volunteer or claiming on a mannequin is very different from doing in patients. So, but there are the AI applications are coming in which help you detect and also do the procedure as well. Now, all these are happening. So, there are robots which are being designed which can do central venous cannulation, which can do difficult blocks also. All these are on the way, but is there a market for that? Do we need it? That's a different question. So, but what also is happening along with this is that we have devices. Sorry. Now, for example, if let's say, for example, using the data in the EHR, so we can detect how many patients are there in the hospital. And if they are being recorded on the systems, it is very easy to predict, is there going to be higher demand for the ICU or not? So if the ICU demand is going to be high, what are the equipment what we have? Do we need to order anything? So automatically, this can help you plan your hospitals as well. But in case if somebody is already on let's say, for example, on a ventilator, algorithms have been developed to predict whether is it the right time to extubate? Is patient fit for extubation? We all had extubation criteria. Sometimes we used to follow, we never used to follow. But these machines, these logging of these things can happen automatically. It will tell you, it can predict whether if you stop ventilating now, is it going to be successful or not? That is the kind of accuracy which is developing in this prediction. So believe me, it is already there. So the artificial intelligence will be able to predict whether the ventilation is going to be successful or not. What also is happening is in the ICU, where the sepsis is a very common thing to happen, or we're scared of it. We will lose patients if we don't manage, we don't recognize early. These golden hours, or first few hours, is very important. So all these AI applications, or the agentic AIs, can pick up these parameters even when they are not suspecting. They can pick up and tell you this patient is likely to have sepsis. So, and we can start putting on sepsis bundles as early as possible. Now, this is a tremendous development what is happening. Generally, humans, our mind is only focused on structured data. For example, we look for a definition of sepsis. wherein which the white cell count has to be more, fever has to be there, all those things are there, and sometimes difficult to pick up from unstructured data. But these AIs, especially if it's a digital form, it can pick up data from the unstructured data also and predict whether somebody is going to develop sepsis or not. Tremendous advantage. Again, the biggest other application which is coming through is the use of antibiotics, AI-enabled use of antibiotics. Now, what it does is, it not only according to the bacteria which is grown, we can feed the patient's pharmacogenomics, or the gut bacteria, or the bowel bacteria, or the condition of the patient, or the previous history. All of them can be integrated to choose the best antibiotic for this patient. This is already being in practice. Antibiotic suggestion AIs are perhaps will replace normally what you used to go through. This will be there whether it is for peri-operative purpose or in the ICUs. What also will, I think, a big part will be enhancing the patient's experience or planning of the certain procedures, in which we can use VR, virtual reality, augmented reality, or we can call it as extended reality. Where all these things can be used? It can be used to enhance our surgical skill training. Of all this, what I feel is AI and this VR devices or extended reality devices are very useful for team training and skill development. So, and to facilitate empathy, all these are very, very important things. Instead of training being long, 7 or 8 years, the duration of training can be reduced. If there's an opportunity to go and be part of it, be part of it. Get us, systematic feedback how we are doing. If you are a senior, especially if you're senior people, there is very, very difficult to get the feedback. Whether you are doing well, whether your communication skills is appropriate or not. All this can be reflected when you start using these extended reality things. And it can enhance the functional skills. For example, recently I was at Father Muller's Medical College, where they have a skills trainer for almost every block. Now, normal simulation can have to see whether you're doing it appropriately or not. So if you have AI integrated one, it can tell you whether you're getting better or not, and what is your comparison with other people, and tell you, no, this is where you're going fault. This is where you're doing things wrongly. If you're not getting epidurals properly, this is probably the reason. All these are there which can help you enhance it. It can also help you plan the things. So perioperatively, where you should do, what is the approach you need to do. All this can be planned with the help of AI. Now, I'm not joking. There are nearly 500 companies which are working on medical VR or AR companies. 500 companies are there which are working on AR, VR devices to help in the medical management, of which acute pain management, all these conditions are being there, where they also are showing evidence. Yes, for example, AR, VR companies are developed system wherein which after an orthopedic surgery, how is the recovery happening? Are they walking properly? Is the gait proper? So, and more importantly, patient education can be done beforehand itself. So you get the patient's cooperation, they know what to expect and how to use it. What better way than to use these AR, VR companies or enabled devices? Now, the other, what also is happening is, I've told so many things what is happening in the AI, but in spite of all these things, what I feel is we are still at a nascent stage, at a very early part of the adoption of the AI in our practice. There are innumerable number of ways wherein which it will enhance our everyday practice. Now, but what we have to remember is when we start adopting it, we start using it, we have to adopt it with all the responsibility, ensuring that we use it in appropriate patients. We should have transparency, and this is again another big topic when we start using it. But what I feel is there are around 5 important domains. AI will be there. We all want it to be there, and it can definitely enhance our things. Now, first thing I will tell you, I'm sure most of the places where you're working, the already digitalization of medical records is happening. The moment the digitalization of data is happened, so it's very easy to develop an AI or agentic AI which can do a lot of things. Now, I will tell you what is an example is of an agentic AI. I'm sure if you go to ChatGPT and ask, I want to go on a holiday to Goa. Tell me what to do. What are the places to see? It will give a list of things to do. But it will give you all those details which you found it very difficult. But it can never tell you which website to book. It will not book your tickets. It will not book your accommodation. You still have to do those things. But in the near future, what will happen is these agentic AIs are, if you have that, if you ask that agentic AI app, will go into the medical records and tell you how many patients after the surgery have been normothermic, how many have got infection rates. So it will automatically collect and tell you this is going to be a big change. Agentic AIs will be there. For example, it will help you in pre-operative medical records also. For example, if you are a system in which patient has got admitted 20 times, and if you ask the agentic AI, it can go search all those admissions and give you what has happened, how many times they have developed renal failure, how many times they have had renotropic support. So all those conditions can be mapped and put it in a place where in which you can easily get this summary instead of wasting half an hour to go through those records. I'll give you one example here, which is from Vanderbilt University. No, it's very common to have ST depression or ST changes. No? So they thought they will use the whatever data which has been there and they mine the data from that. Okay, they wanted to find out how people are reacting if they see ST changes. Okay, now in that they found that they had in 10 years they had so many number of cases and so many number of cases had ST changes. Now they wanted to see how long before people reacted to that. So what did they do? Now it was very intriguing when they looked at what people have done when the ST changes. Some people have managed with beta blockade, some people have given fentanyl, cardioversion, some people have aborted the surgery. All these are collected without, these are retrospective data. So in which it has mined the data from what has happened in the EHR records. So patients, one of them had a perioperative MI, and did the request for cardiology consultation, all those things, it could mine the data. This is unstructured data in which you can use AI to go and look what has happened, that we learn in future everyone does the appropriate thing. They also had a look at what is the best thing to do. For example, I don't know what is your favorite choice of fluids. In that particular population, they wanted to see that the balanced crystalloids are good or the good old saline is the best thing. So it was very easy to mine the data and see how many patients developed renal failure, right? So whether they compared normal patients, those with critical illness, and those who had a balanced salt solution and saline. And it was a very clear evidence that patients who had balanced crystalloids were doing much better compared to the saline group. Now, they didn't have to do any systematic thing, approvals, not looking at the data for the last 10 years, looking at each patient, they could get the data wherein which if you are using balanced crystalloids, number of patients who are likely to have renal failure is less, whether it's critical ill or non-critical ill. In both the categories, they had a significant difference. Now, other thing wherein which this AI can be used is to see how the clinical performance is happening. All of us want to ensure that the certain quality is there. Even way back in 1983, people were looking at what is the quality of service which is being delivered. So there was one particular article which was published wherein which they had collected using semantic network to see how many patients had PSC, how many patients had a pre-medication, how many patients had pre-observation, how long did they stay in the recovery, so how much pain did they have, uh, categorize those patients according to physician, and it was given as a structured feedback so that people can get better. Now with AI, it will even going to be better. AI will help you design a fantastic treatment plan. Can make your plans even more precise, especially when we start developing digital twins, wherein which you know how the heart is going to react, for a stress, especially if you collect the data from their own wearable device. So how much does the heart rate increase when they climb 1 flight of stairs, 2 flights of stairs? What is happening with the blood pressure? So what is happening with their oxygenation? That can help us predict how the patient is going to behave, not only cardiovascularly, but other organ diseases as well. This is all based on patient's own data. There is no normalization here. It's based on patient's own data, and that is going to happen. And this precision healthcare, which we talk about, will be even more precise. Now, we all know the precision medicine is something which is on the cusp. Especially those of you who are practicing TCI or TIVA, you already know we are trying to precise. We are going to be more precise by using not just the patient's weight. If we are using age, height and gender, you can much more give a safe dose or personalize the medicine. On top of it, we are also having newer data, which we call it as omics data. All those which end in omics, no, that's called as omics data. Pharmacogenomics. Now, we all know that there are some people who go to sleep with very small dose of propofol. Some may require a large dose of propofol. All this is because there is a genetic difference. We've already found out what is a gene which makes people very sensitive to the propofol. The same thing is happening. If you give this medication or if they eat this food, what makes them go abnormal in their metabolism? Why do the sugar go up? So what happens when they eat this fruit? And what is the impact of the microbiomes in the gut? So all these things can be fed into the digital twin, along with this data from the sensors. If all these things are there, believe me, with the AI, you can plan the best of the anesthetics, just what is required, and help in the recovery as quickly as possible. Before I finish, I want to tell you a few things. There is generally, we always overestimate the change that will occur in the next 2 years, but underestimate the change that will happen over the next 10. I really want you all to focus on what are those technological advances which are happening, and what are those which are going to make us better in the next 5 to 10 years. I strongly feel the currently what is happening with the AI and all the digital advances, entire ecosystem which is developing, this is going to be a big change how we do practice our medicine, how we give anesthesia, and how the patients recover it, how we can enhance the recovery. So even though Gartner hype cycle is relevant, but I strongly feel in the next 5 to 10 years, this is going to be something everyone will be having. To conclude, I feel AI has a potential to transform medicine and improve patient outcomes. So it is very important that we associate with it early and start to use it more responsibly. It is likely that it will become a very important tool, not just in healthcare, in everyday activity of health. So as clinicians, I certainly feel sometimes when there is a novelty like this, we get blind. We should not be blinded by what is happening, but carefully investigate the safety and the potential clinical usefulness and adopt it. But I strongly feel with so much of ecosystem, the entire digital ecosystem changing, and the AI coming in, and then quantum computing coming in, this will dramatically change how we are doing. Again, quantum computing is something which we have to be aware. It is like having 10,000 computers in one computer. It can do 10,000 times faster than any of the computers what you have. So that is the kind of change it's going to have. That means, if you give an article for me to read, I will take probably half an hour, nearly 45 minutes to read an article. If you give it a ChatGPT in matter of seconds, it will give you, the summary from that. But this is 10,000 times faster than that. That is the kind of changes which we will be seeing when we start using quantum computing. That's all for now. Thank you.
Thank you, Dr. Subramanyam. It was a very, very exhaustive and a very, very an eye opener. We didn't know many things that you have just come out with, but just wanted to ask you, what would you think would be the dangers of this AI, especially in our anesthesia practice? I mean,
what is happening is a lot of times I personally feel is we doctors are not getting involved in making it relevant for our practice, relevant for patient care. Now, the technologists are people working on this. For example, I was telling you about all those various wearables. Now, we have not got involved. Either we have hesitation to go and experiment it, or so automatically it is coming in now. But some things will happen like that. For example, this continuous blood glucose monitoring. To take that example, believe me, there are people who can afford 5,000 rupees for that continuous blood glucose monitoring. For 15 days, you can continuously monitor your blood sugar. Now, should we enable the patients to act on it? May not be, but it's a very good reflection of what is happening to their blood sugars when they are sleeping, when they are walking, when they are talking, when they are eating. How early, if they eat this banana, what time it takes to eat. If they eat 100 grams food, what will happen to the blood sugar? If they eat half a kg food, what will happen? It's a tremendous amount of data which is coming there to us, for patients to look at, and also categorized. No, it will also tell you it's in the normal range or not, and also gives you an estimate of HbA1c. So that is the kind of changes are there. AI uncontrolled, I mean, because see, one of the things I was reflecting on is we have to feed the data. Now, for example, we are trusting Apple phones, other phones, to collect our names, to collect our data, and to protect it responsibly. But the data theft, can it happen? That is something really worrying. So, but without us getting involved, without developing the framework, if we leave it for somebody else without doing this, so it will lead to a place where it will be not be used appropriately. So, no, we all have to be aware of DPDP Act, Digital Personal Data Protection Act. What are those things which we have to protect? What we can share with the AI apps. So, all this is a process, and we can make sure that the process is robust only when adequate number of us get involved in it and start to work towards it. For example, I talked about smart socks or smart gloves. Now, we have all seen patients with, for example, let's say stroke. We want to improve their physiotherapy. We want to make sure that their hand movements are appropriate. If there is a glove which can quantify what is happening, is 5% improvement per day, 10% improvement per day, show it in a graphical form, such an incentive for the patient that they will start to work better. Now, I was talking about pharmacotherapeutics, digital therapeutics. That's a big domain. I will tell you one simple example where in which digital therapeutics is making a tremendous difference. There are a number of patients who have, for example, they cannot hold their urine, incontinence of urine, or incontinence of bowels. Now, a lot of doctors don't even want to care for them because they keep coming, they'll give something and send them off. But if you are somebody who is using this particular digital therapeutic device, there has been 70% of the patients have found more control of their bowel and bladder. Right now, if we don't get involved, systematically learn why this is happening, why this is not happening. This is an FDA approved device. It is already there. So, I mean, I was just giving you a few examples. Anything specific, Dr. Kalpana?
Are there any AI generated apps already available for clinical application for risk stratification in patients, apart from what we already have? Like we have the RSRI, the Lees Index already given to us, but are there any better apps which are available which will help us to stratify our risk stratification of our patients?
Tremendous. I mean, this is something which I am passionate about, right? For example, when we go and see patients, why? I mean, we always put one classification, one risk stratification. The only thing is ASA 1, 2, 3, 4, 5. Apart from that, now we don't systematically follow because it is onerous on us, right? So to check the heart rate, to check the blood pressure, the weight range, and investigations, all this happening. So believe me, I mean, we can all work together also. if you develop an app which can just access the PSC, all those parameters what you are fed, it is possible to calculate what is the Goldman risk factor for this patient. So it can capture not only from the PSC data, from the other medical notes as well. It can go and tell us what is the Azorella risk for respiratory failure. It can predict how long is going to be the wake up time. All this is possible to predict, but we have to ensure that we work on this. Maybe the people who are there, our younger generation, will start to use it more often. Now, standalone apps are there. There is an app in which multiple things we have to enter. For example, child's index, no, or for example, patients on the waiting list for liver MELD score. All those independently are there. But is it possible for one application or agentic AI to integrate and can go and collect from the patient's system? 100% possible. Now, nobody has invested it because there is no direct value for direct. It's not a direct money-making thing. But we all know it is useful for us. We have, as a anesthesia society, can invest into it and develop. So you develop an app, so you just give access to the patient files. It will tell you all the risk factors and lists it. The insurance companies don't want us to do it.
I have with us our head of our Department of Anesthesia, Dr. Halbe, and two other senior anesthesiologists with us, Dr. Daigode Madam and Dr. Nayak Madam. I would like them to put their expert comments on this talk. Madam, you have to unmute yourself. Halbe, Madam.
Yes, I have done it.
It's a pleasure, madam.
It was a fantastic lecture.
Ma'am, please share your suggestions as well, ma'am.
Sorry?
I would say this
No,
was
it's wonderful to have you on board today. So I'm sure with your experience, what has happened, there are a lot of things. The way you see it is very, it is wholesome. So we want to hear your suggestions as well, ma'am.
This is Dr. Halbe. I would say it's an eye-opener. I was thinking as a senior person now, I can just ignore this AI thing. But after you are listening to you, I think I should also be interested getting involved in this. And luckily, I have my grandchildren, they have already started doing it. So I can take their help, and it will be really very interesting. Secondly, now I want to ask you, my constant fear is, whenever I do any case, last week I did 3 cases continuously in a prone position. Okay. And my worry is taking care of the neck and taking care of the eyes. There is no way you can make out, whether you try to give best position. Still, there are reports which are blindness, Something, if AI can help us in this matter, it will be great. It can give us indicator. Okay, eyes are getting compromised, the blood supply is getting compromised, or neck is getting compromised. You have to do something about it. That will be great. That will be my greatest thing.
Ma'am, it's a wonderful suggestion. I'll see where I can take this or spread it among the people.
So this is my constant fear. In fact, I get up with nightmares, at times whenever I do these cases, because there's no way you can make out,
True, ma'am. Ma'am, few sentences I'll share, ma'am.
Yeah.
Now there are what are known as smart plasters.
Okay.
People have understood that the money has gone into that to work around smart plasters. What these smart plasters do is, on a wound, if you put it, it will tell us what is happening with the wound status.
Right.
So the earliest generation was only change in the color. Now these are all embedded with micro crystals. It can tell you what is the acidity of the fluid there and what is happening with it. So whether the wound is healthy or not, it's getting infected or not. Now, is it possible to have small plasters wherever we think it is there, which can sense the pressure and tell us, oh, the pressure has been too much on the eyes or something? It is possible. Is it possible? I definitely say it is possible. But we have to find the appropriate people who can work on it. This is a good idea. For example, we know this is a clinical problem.
Yes.
So we need to find people who can work on it, and it is possible, 100% possible, ma'am.
Yeah. So see,
So,
once now, while it happens, but when it happens, it is 100% for the patient, isn't it?
correct, ma'am. Correct, ma'am. So,
Yeah.
so let us see, ma'am. I will also take this. But if we keep talking like this, it's a fantastic idea which I never thought about. So, it's new thing which has come. So that is the idea. That is the beauty of experience. Where, for example, I've been invited for the MUHS, the Maharashtra University of Health Sciences, wherein which they want to do AI meet with the IIT people. So
Okay.
I will certainly take this idea and the next month when I'm meeting them along with the IIT people. So to see, do they have any mechanism to work on this? These are all the practical problems, at least from the anesthesia side, I can say,
Yes.
can we devise? If there are people who are, there are people who have loads of money who can sponsor those projects to see if we can exhort them to see, kindly invest in this. Don't waste it in, RCB matches or Mumbai Indians matches. Why don't you put some money into this, which will help everyone? So let us see, ma'am, how it goes.
Thank you so much. Thank you. It was a wonderful lecture. Very.
Yeah, it was a fantastic lecture. I feel we should you should share the slides with us so we can continuously keep looking at those and then what advances are happening sooner or later. Another thing is I want, of course, what she said is prone position, but in babies also you have to take care of the nerves whenever there are different positions given, side position, whatever.
True,
So
ma'am.
that also I think we'll have to, take care of that. And another thing is, as she said, when we are judging the patient vigilantly and forming our opinion, I think AI will endorse our clinical judgment. I think that will be
True, ma'am.
a very good point initially, at least to have the trust in the AI, whatever comments they give. And yeah, it was a fantastic lecture.
What I see is, ma'am, AI is not going to take over our anesthesia part. What it will do is it will enable anesthetists to be even better than what we are. So, for example, I'm telling you, it is not difficult concept. There is a mattress called as dozy. If you put that mattress under the patient, it can do continuous monitoring of the vitals of the patient and transmit along. So can the day same kind of mattress or bed sheet can be put on under the patient, which can measure certain things, including the pressures? I certainly think it's possible, ma'am. So we have to put our mind and effort. It's possible.
Yeah, yeah. One thing which I wanted to share my experience, twins, both weighing the same weight and same dose I had given as a pre-med, it worked differently. So how will the AI will help in these cases? Because their mental setup was good. The one child was very brave and very social and communicative with me. The other one was always anxious, sort of, thrashing around and all that. So how AI will help in these cases?
Ma'am, 100%. This is the types of scenario. For example, I'll tell you a small story, just taking you beyond. Um, you know, uh, Nowadays there are headbands, just like normal headbands. You put it on the forehead, or there are some earphones. You just put it in the ear. It can record our EEG activity. Now, how the EEG is going to help us is to understand when we are sleeping, how relaxed we are. Is our sleep good enough or not? When we get tensed up, what happens to our brain activity? And this individual difference is capturable. It's not only capturable, it is quantifiable. Now, for example, uh, that could help us. For example, they could have the same genetic material, but because their brain activity is at the different levels, they've had adequate sleep or restless sleep, whatever is there. Believe me, in that developing neural networks, we can definitely uh, have an app or a AI-enabled app to see the dose should be more or less. It is possible, ma'am. It is possible. But I'm saying, can I do it? I may not be able to do it now, but having understood the ecosystem, the subject a little bit more, so I think it is possible. For example, not only those twins, ma'am, the same patient coming at different times. Why do they need different? Is to put them to sleep. I'm not, so it is possible, wherein which we can understand what is, because basically when we are anesthetizing, it is not like sleep, where the different, the electrical hot points or hot zones in the brain, their interconnection is being disconnected for some time. And we don't want to disconnect it completely. That is why we don't want to give over anesthesia. So that is why, we want to monitor BIS. We don't want to go at less than 30. We don't want burst suppression activity. We can monitor it and make it precise so that nobody goes into that altered confusion status. So exactly amount what we can do. So I think we will be able to predict, because of AI, whether the anesthesia for that person is request same amount, different amount, by how much also.
So preoperative anxiety score, will it be?
Yes,
will we
ma'am.
be able
Yes,
to?
yes, ma'am. I certainly feel so, ma'am.
And one more thing, just with all these things, going global, will there be any privacy maintained?
That is the fundamental I mean, the risk which is there in this system, ma'am, because this is not a government app where we are sharing. So I mean, even government apps get stolen. The insurance data gets stolen. So, but uh, what the government is coming up with a framework, ma'am. I've been part of that advisory group, wherein which what data encryption should be there, what data should be stored, what data can be shared. So, and that there is a clarity, and if data breach happens, what is the penalty for the breaching? So all those are being mechanisms are worked out. The government of India has already passed this DPDP Act, but it is not enforcing it. Just like how HIPAA is there for the US or GDPR is there for Europe, this personal data which can be identified to that particular person, how to encrypt it and how to regulate that encryption is happening, just like how NABH is mandating us certain things we do that way. The same kind of DPDP Act, whatever we are enforcement, whether we are encrypting, has to be part, ma'am. It will be part.
Yeah, because these days, day in and day out, people's mobiles are getting hacked. So,
True, ma'am. True, ma'am.
will there be any, safety in providing all these things?
Absolutely, ma'am. Even if you ask me on my WhatsApp, with of course with my better half, I have my Aadhaar card shared with her because she forgets some things I have. So my PAN card number is there. So even just getting into our WhatsApp, that can compromise the safety. But the government is aware of it, ma'am. It's forming panels. The overall, what also has happened is it's not just about the country, the international framework is also happening, ma'am. So there are international framework guidelines. What are the things we should keep it personal? We should encrypt it. We should not share. What data can be shared outside the country? What needs to be stored in the country, and in what form it has to be stored? And when people visit, what access should be given, and this access, who are all permitted to access this. So all those things are being worked out both at the national and international level, ma'am.
So sooner or later, there will be strict regulations about.
It will come, ma'am. Just like, for example, if NABH or they come to visit for the hospital, they will look at whether you have an ICU, you have a place for adequate number of toilets in the ICU, hand wash areas. Same thing will happen with the data also. What kind of storage are you have? So what kind of security encryption you're having? So when suddenly somebody comes and asks what data can be shared, what can be shared with the insurance companies. So all those slowly it is coming, ma'am. But hopefully, without much damage, we should reach there. But it is coming, ma'am. It is people are. I mean, it's not happening at the pace what we want, but it is happening, ma'am.
Yeah. Thank you very much. It was very nice explanation.
One more question. Did you take a special training or something there about how much, how do you know so much? That's what I want to know.
Ma'am, for the last 2 years, I have enrolled myself for the digital health course from IIM, ma'am. So I completed that around nearly around a year back. one of the first few people who credentialed as a certified digital health specialist. I'm also part of that Digital Health India group. Actually, when it opens up, I will tell you, probably in a month or so, we will be releasing a digital health journal. One is as a newsletter and also as a journal of a lot of exciting things, what is happening outside the country, inside the country, so that people know this is happening. So and we hope that starts as every 2 months, but every month we want to do so that it can reach people and understand. For example, ma'am, even in my own hospital also, the Akhila Bharatiya Digital Health Mission, ABHD, few people have idea what it is, and people even don't know, e-Sanjeevani. Let alone corporate hospital. Okay, people don't even know what can be used for. So, and I was telling you this Bhashini, such a wonderful thing, ma'am. If anybody comes from, let's say, from Bengal, it is quite common to come to Bangalore. I can easily speak in their tone. They can speak in their tone. I can understand it in my language. So we should start adapting it. I feel the more we adopt, the more we use, it will pick up our language. It will pick up our lingo. So future is exciting, ma'am. I think, but at this point of time, it may be a little bit, feels, oh, it is overwhelming. But I think uh, uh, it's an exciting time to get involved into this domain and work to make sure that it helps everyone.
Thank you and congratulations, sir, for doing so well in this field.
Anything else?
Mr. Erin Nathan has raised his hand. Do you have any questions, sir?
I do.
Look, I caught my good old friend. I can say he's one of my very good friends from my UK times, ma'am. So perhaps my closest friend there. We studied for FRCA together. Ari, I'm happy to answer anything. I'll try to answer.
Well, I was going to answer the question that the previous person asked. So Subra and I sat the FRCA exam together, and I swear Subra has two brains. His knowledge base is just phenomenal. So that's why. I just want to say thank you for a very thought-provoking talk. Obviously, you're very enthusiastic about it. I don't know if you or your trainees use, for example, ChatGPT to upload an ECG or an X-ray, and it will actually come out with an accurate result. So it's as good as a good doctor. But the problem with sort of AI at the moment, it's in its infancy, is it can hallucinate. So it can actually produce make-up data. So give you an example, I said, just tried it out and said, can you provide an evidence-based presentation on a subject? And it will actually come out with a really structured, ordered presentation. All the slides are there. But if you look at the references, it's all made up. So my worry, and if you have any advice for me, is how to sort of being over-reliant on the AI and be sort of think critically, because what's happening now, I don't know if it's the same in India, is a lot of people follow social media, influencers, etc., and accept things as it's said rather than critically appraise. Certainly in the UK, people only critically appraise on one day of the year. Do anyone know what that day of the year is? April the 1st is the only day in the UK, April Fools, that people actually think, could that be true, or is this something made up? So do you have any advice for me really on how to make sure that what AI is coming up with is actually true and not sort of made up?
Very, very relevant question, Ari. Now, the output from the AI is dependent on what we train it with.
Yeah.
So, and now initial training has happened. The ongoing training, what is happening is all dependent on what people are feeding it in. So it is learning from what people are feeding it in. If there are 100 people feeding in wrong information, it will take that as an associated thing and can interpret as a absolutely right thing, and that is what we call as hallucination there. So any moment any of us feel that no, this chat GPT or the answer is inappropriate, we should be straightforward in communicating it back to it. You are wrong. This is wrong. The literature doesn't support it. You are putting a wrong literature. It will learn from that. It will learn from that. That is one way of people. That is why it is still. I'm sure majority of the hospitals, even in India also, the hospital networks will not allow you to access the chat GPT. I think the same thing in UK. So only in your personal phones you can access. Official hospital provided networks still don't support because they are not sure how things will go. But what I feel is, yes, there are episodes of hallucination. Because we are all trained, we can see which one seems accurate, which one doesn't fit in with our normal, regular intelligence, which is not an average intelligence, it is super intelligent. It is only artificial there. We are super intelligent, everyone who is trained. And the moment we find out if something is wrong, I think we should train the AI. It is wrong. You are wrong because of these reasons. And I'm sure the AI will get better.
Agree. It's in infancy, isn't it?
Yes, so true, so true.
Thank you. Thank you.
I think, Dr. Subramanyam, you've done a real good justice and kept it like a real eye-opener for all of us. And I'm so happy most of the residents have attended it. And if any of them can pick up a cue from this and maybe work ahead in AI, especially for anesthesia, it'll be a feather in the crown.
I certainly feel we can work on clinical decision support systems, integrate it with our already existing EHR, or run parallel to it. It could be for the, somebody was talking about, disease stratification and prediction, how they're going to do, or it could be, just the antibiotic usage. So all these things is very easily achievable, low-hanging fruits. So I hope it inspires them to carefully look into it and start with an open mind.
Yes.
Yeah, can you possibly share your slides with us?
I definitely, ma'am. I'll share the PDF version. I think the.
I'm not going to give a lecture.
No. The Kalpana can share the video as well. I think Kalpana can share the video if you don't mind.
Sure.
Yeah. Thank you. Thank you.
So with this, I thank you once again for being on our platform, and thank you so much for spending the time, all the delegates as well. And I look forward for some more of inspiring talks from you. Thank you, everybody. Good night. Have a pleasant weekend.
Thank you all. Have a wonderful day.
Thank you, sir. Thank you, sir.
Thank you, Kalpana. Thank you all the senior faculty here. Ari, nice to see you. Very
And
much.
you.
Thank you very much.
Thank you all, guys.
It was fantastic.
Thank you, ma'am. Thank you.
Thank you, sir.
Thank you, everyone.
Thank you.
Thank you.